Hair loss and the management of hair loss has always been a significant component of aesthetic medicine. We deal with it in the general medical population, but we're able to offer sort of a different approach, a different viewpoint, and just more services when we're talking about the aesthetic approach to hair loss. My name is Dr. Rohan Bissoondath. I'm the Medical Director at Preventous Cosmetic Medicine. Today we're going to be discussing the foundations of hair loss management. We see hair loss in men and women. Typically, our patients tend to be more male because male pattern hair loss is certainly driven by testosterone, and it's something we see commonly through the population. Now, whether we're dealing with women or men, the first thing we want to deal with is their underlying health. We want to make sure that they're functioning well, and that if they do have any underlying health conditions, whether they're known or not known, we want to address them, identify them first, then address them appropriately. So we don't want to separate hair loss from the overall person, because at the end of the day, your hair and your hair follicles are only going to be as healthy as that individual is. If you're not leading a healthy lifestyle, how could any organ in your body be optimized? So if you're getting enough sleep, eating well, regularly active, all of that, believe it or not, will impact your hair follicles and the growth of your hair. When I think about hair treatments and hair protocols, I sort of have a hierarchy. There's those, like anything in medicine, those with the most science behind it and a great track record, all the way to newer technologies and newer treatments that are emerging or evolving. And while they might have less evidence behind them, they certainly play a role in augmenting an individual's hair growth. I think of it in terms of a pyramid. So if we look at the bottom of that pyramid, we've already started with that, their overall health and lifestyle. Next are oral medications. So if you picked one treatment or one medication that has the most science behind it, and we know it's going to make a difference to that individual's hair, it's going to be finasteride. Finasteride is a medication that is sold under the brand name of Propecia. That's where people may have heard about it. It is intended to slow down male pattern hair loss, and it works at the level of testosterone. After the oral medication, finasteride, we look at topical medications. The topical medication most popular, and that's been used for a long time and where there's a reasonable body of evidence behind it, is minoxidil. It's a lotion that you apply to the scalp, and it is known to augment hair growth. After we utilize those two medications, we move forward to PRP. PRP is platelet-rich plasma. What's nice about that is it's derived from the patient themselves. So we draw your blood, we centrifuge it and prepare it, and we take out a component of the blood that is platelet rich. That component has healing factors, growth factors in it. We inject it into the individual scalp, so we're using that individual's platelet rich plasma in their own scalp. It's a series of treatments that are performed over time, and we know that that will augment and stimulate the hair follicles to improve, and we've seen significant improvements in hair growth. So when we meet a new patient who's coming to us with the concern of hair loss or hair quality, first thing we do, take a proper history, make sure there's no underlying health conditions, and if there are, we address them. We move forward with oral medications such as finasteride, topical medications, minoxidil, that we are known and have been used extensively over the years to augment hair growth and reduce hair loss over time. After we've utilized those, or if the individual chooses not to utilize those, we can move forward and add PRP into our treatment regime, platelet-rich plasma, augmented oftentimes by red light therapy.